You are watching Eagle News America. I'm Ace Ramirez in Washington. According to Mental Health America, women compose 4 out of 5 who have seasonal affective disorder or seasonal depression. The critical age for seasonal depression is between 20 to 30 years old or earlier. Up to 10% of the population has seasonal depression, depending on where they live. To add to that, the further you are from the equator, the more likely you are at risk for seasonal depression. To help us understand this more, we have clinical psychologist Dr. Sydney Fontanares. Dr. Fontanares, this kind of depression affecting about 10% of the population is not something to take lightly. What is SAD, or what is seasonal affective disorder, or otherwise known as winter blues? What are the common signs and symptoms of SAD? Doctor.
Hi, Ace. Thank you again for having me. So SAD stands for Seasonal Affective Disorder, which is a clinical diagnosis. Actually, it's a subsection of major depressive disorders. So we have major depressive disorder, and then we have different kinds of depression, and one of them is SAD. Affective, in a clinical sense, means feelings, mood. So when this is happening, when you're experiencing SAD, your mood changes. You're feeling a little bit off, and this will look like depression. And this will happen when the seasons change. There is winter onset, and then there's also, I believe, summer or spring onset. But the one that we'll be discussing today is winter onset seasonal affective disorder. This is when fall turns into winter, or it even starts at the beginning of summer. We experience these symptoms, and then we start to also notice when winter turns into spring and summer, these symptoms seem to disappear. This is sometimes can also be called winter blues. That's a little bit what maybe the majority of individuals experience. About 10% experience mild symptoms, and then 6% of the population will experience more severe symptoms.
Well, doctor, you said not just all along. I thought it's just applicable to the winter season. So it's not just winter, it's applicable to all seasons.
Yes. So specifically, this kind of depression will happen when the seasons change. When we experience major depressive disorder, this is kind of all throughout the year. But what is triggering SAD is the change of season.
So can this happen to anyone without any hereditary history?
Oh, absolutely. There is. So in terms of I guess developing SAD, there is a connection to hereditary component. So you're more likely to develop SAD if maybe a relative or maybe your parents have either major depressive disorder or any of the other mood disorders like bipolar, 1 or 2. You're more likely to experience it. And like you mentioned at the beginning too as well, women are more likely to experience it. People who live farther away from the equator, who have less daylight time. So you're like Alaska. We see a lot of this in Washington State, Oregon. Once winter starts coming up, or it's starting right after fall, we do start to see the numbers increase of people experiencing depression. Also, those who have depression already that they're experiencing, they might also experience an exacerbation of symptoms.
I see. So, doctor, can you enlighten us? What causes SAD?
Like with many mental illnesses, there isn't one factor. There are many factors. There's also a lot of different theories behind SAD, as well as many other mental illnesses. Researchers, they gather data and they try to make the most sense out of it. What we've noticed is that there are like three components for SAD. One of them is just a change of our neurotransmitters. So there is, what they're seeing is that there's a drop in what we call serotonin, which is a neurotransmitter that regulates our emotion. We see this in major depressive disorder. We see a drop in serotonin, and that starts to affect our mood. Another hormone or another bodily change that happens in SAD is also a change in melatonin, which is a hormone that our body produces, and it also regulates our sleeping. So one of the symptoms of SAD is hypersomnia, where you sleep more. And then with major depressive disorder, you sleep less, you sleep more, your sleeping patterns kind of all over the place. So serotonin, melatonin, and then there's been a little bit more research on the circadian rhythm. Our circadian rhythm is our internal body clock. It tells us when we wake up, when we go to sleep. And so when the seasons change, here in California, we have daylight savings time in occurrence with the change of seasons. So we get less daylight. I commute in the morning, I don't see the light, and then I commute back home and it's already dark. So when that changes, our circadian rhythm goes a little off. It kind of goes out of whack, and that's where we again start to experience some symptoms, mood changes. So plenty of people will experience that just because our bodies are so used to a particular rhythm.
So the internal body, you mentioned the internal body clock. Let's say I work at night. I'm the graveyard. Mm-hmm. So that may affect my mental health. I may experience SAD because of that.
Overall, your mental health will be affected if it doesn't totally follow your natural body clock. And in fact, there is an increase or a bigger number in individuals who do graveyard shift with mental health issues. So increase of depression, anxiety, that sort of stuff, because it's your body's trying to follow a natural rhythm, but we're kind of working against it. And we are seeing a lot more just because of the advances in technology, and we can kind of work all throughout the day and all throughout the evening.
Right. So talking about the symptoms of SAD, are these noticeable from the naked eye, from a layman's observer? Can we tell, let's say, a person is undergoing or experiencing SAD? Or how is SAD diagnosed? Treatments?
Going to your original question, Ace, I would say it's not that obvious. Whenever I speak to a patient and I say SAD, I do get like a surprised look. I hear a lot of people haven't heard of it. They didn't even know our bodies kind of go in that kind of rhythm. Again, like you're kind of protected from like the seasons because of shelter and being able to go indoors and regulate the temperature. So being able to say that the seasons affect you is kind of an eye-opener for a lot of people. And even identifying a major depressive disorder, there's a whole spectrum as well. You could be at the mild symptoms and not really be able to identify that you're experiencing some sort of mood disorder. So some symptoms that you can experience, like I said, SAD looks very similar to depression because it is like a subclinical set of, or it's a diagnosis of depression, but changes that you can see is changes in sleep, eating, also wanting to isolate. It could also get in the way of your thought pattern, having difficulty with concentrating and focusing. It can get in the way of work and doing school. That's where, when it starts to affect our schooling, or going to school or homework, going to work, that's where we start to, when the red flags start to come up and we're like, this is probably a diagnosable issue right here. And so some specifics with SAD is that, like I mentioned, you're sleeping more, hypersomnia. There is also weight gain, which is because you're eating a lot more. So your eating pattern has changed. Something I just recently read was that there is a craving for carbs when you're experiencing SAD. So like your pastas, your bread, your all the kind of the white colored foods you're kind of drawn to during that time, and also isolating. I think they had written like hibernating. So I was like thinking like a, kind of you're experiencing like bear-like symptoms. And then of course your mood has changed. Maybe you're more irritable, and more anxious or more sad.
Okay, doctor, hold on. Let me cut you right there. I have a lot more questions, and I believe the other correspondents have more questions later. We'll be back after the break and we'll discuss more about SAD. Thank you for enlightening us, Dr. Fontanares. Some of our viewers may be asking in their head right now, seasonal depression during a pandemic, how bad is that and how can we prevent it? Our virtual roundtable discussion continues in a moment. This is Eagle News America. Stay with us. This is Seasonal News America. I'm Ace Ramirez. We are entering the winter season when SAD, or Seasonal Affective Disorder, is said to be more prevalent. How likely and risky is it to develop this type of depression during a pandemic? As if the impact of the pandemic is not yet enough to negatively affect our mental health, what are the risks of combining this with Seasonal Affective Disorder, or SAD? Doctor, can you tell us, how bad would it look if we combine these two?
It would be pretty intense, because as we had discussed earlier, Ace, we can see so many changes that's already happening for us with the seasons that have changed, or while the season had changed. And this is something that happens if you are diagnosed with SAD on a regular basis, right? There's kind of already a timeline that you follow. But with the pandemic on top, there isn't quite a clear timeline. With pandemics or very big events, there's usually a beginning, middle, and end. And right now we're in the middle, and we don't know exactly what the end will look like. And that causes burnout for a lot of people, especially if maybe you're in the healthcare industry and are, needing to continue to work. We don't really, see that, because there's a lot of unknowns. We don't know exactly where we can say, like, this is the end of the pandemic and we'll be okay again, right? So it's going to take a lot of mental energy, a lot of changes in our psychology, and it will exacerbate any symptoms that we already are experiencing. That we call it pandemic depression, because we've have been experiencing just a lot of changes and anxiety and depression since the pandemic had started. And again, there isn't really an end that we can see or be able to pinpoint. There isn't a date, with seasonal affective disorder. We can say hey, maybe the summer, spring is a little bit better. But with the pandemic, it's a little bit harder. And so it's, again, it's going to exacerbate a lot of things and make us. Mm-hmm.
You mentioned, you gave the scenario, what if the healthcare workers suffer both? right, during this pandemic, and then they experience SAD. We've defined SAD, who it affects, what triggers it. We painted the scenario in a pandemic. Please share some tips. How do we prevent SAD, or how do we strengthen our mental health?
So specifically speaking about SAD, there's been a lot of research using light exposure or light therapy. You would want to talk with your doctor first, because there are risks in utilizing a light box or an SAD lamp. It can, affect, I think, if you're taking a particular medication, or if you have particular symptoms, or even like affect something with your eyes. But the idea with light therapy, like we had mentioned before, right, where SAD occurs or can be developed if we're not having enough sunlight, and that's what these lamps would, or these light boxes would help with. It's supposed to, like, it's a particular light bulb. There's also like tips on how long you should be utilizing the light box, even like the angle of the light box and how effective it can be. So talk to your doctor about that. Also, being able to talk to them if there is any medication that can be utilized to help support you. And having these conversations early, so you can prepare for when the seasons do change, and already having those conversations with your doctor. Also being able to what we call behavioral activation. This is something that we utilize with people who are experiencing major depressive disorder. If you're feeling down and unmotivated, you're gonna be stuck in that cycle, and you're gonna, that's gonna affect your sleep, that's gonna affect your daily routine. And so when I talk to my patient, I ask them to, name, your daily tasks, and being able to do that every day, even if you're not feeling 100% or even 50%, to still be able to do that and activate yourself. So you can, you really do have to be proactive in working through the depression and the symptoms.
But doctor, not that 4 out of 5 of our correspondents have SAD, but I'm pretty sure they've been taking notes, and they want to ask you questions about SAD. Let's start with Thomas. Tom, any questions for Dr. Fontanares?
Yes, I've got a couple, if I can be permitted to. First, do family doctors take this seriously? Because a lot of doctors are still very much on the science side of medicine and kind of leave out the art side of medicine. And the second one, quite a bit different. Have there been studies done on the economic cost of SAD?
Well, Thomas, I can't speak on the economic cost. I'm not totally familiar on that. But regarding family doctors, so I work in what's called a multidisciplinary treatment team. So I do work with medical doctors and do provide consultation. So I want to say that, family doctors are a little bit more informed about mental health in general and are getting more training around that. But certainly, it's going to take maybe a little bit of advocacy on your end as the patient to be able to bring this up. That's a way to be able to do that is to track yourself, to be able to, see, even starting from summer to spring, being able to track any changes, any mood changes. And the thing with SAD, however, is that to receive the diagnosis, I believe you have to have, 2 years, 2 consecutive years and experiencing those consistent symptoms. So being able to have an ongoing relationship with your family doctor to be able to continue to report these symptoms so they can support you.
All right, thank you, Doctor. Rani, any questions for Dr. Fontanares?
Doctor, what about alternative types of treatment other than antidepressants? What recommendations do you have? I mean, like meditation and gratefulness. What do you have?
Sure. Alternative methods other than medication. As a psychologist, I always recommend talk therapy, being able to work with a therapist. a therapy that I would recommend specifically for SAD is what we call CBT, which is cognitive behavioral therapy. And that's where we take the thoughts that you have and what kind of behaviors you experience because of these thoughts. And usually negative thoughts will lead to depression and the behaviors of depression. And so we take those thoughts and try to challenge them or try to adjust them so they're healthy or more positive thoughts, but not to go into positive psychology, but being able to work on these thoughts so we can function a little bit more effectively. And of course, if therapy is not your thing, I always suggest being able to inform yourself, and I always encourage my patients to look for coping tools or coping mechanisms, and it could be meditation, expressing gratitude, any way to be able to move your body and get out and get the sun, specifically for SAD, is going to be important.
Great tips, Doc. Thank you so much. Maricar, do you have any questions for Dr. Fontanares?
Yes, I do. Okay, so I'm a gerontology university student, meaning my field of study focuses on older adults. So my question is about seasonal depression amongst the older population. So how does seasonal depression, especially amidst the pandemic, disproportionately affect the older population, since they are typically vulnerable to, the impacts of social isolation and loneliness during this time? And what types of support can we give our older family members?
Very good question. Like we've talked about before too, like just the kind of the pandemic depression on top of any sort of SAD or depression that you're experiencing, we're going to see that exponentially with our older adults, and it's certainly happening, and especially because the pandemic is that's considered the vulnerable population. We are needing to keep our older patients isolated and quarantined or and safe. So if there's any way to be able to connect with them, any sort of like social support, I know FaceTime or having kind of like a video chat is not the same as having in-person visits, but that's kind of where we're at in trying to provide and support our more older patients. Any way that we can help them connect with a hobby or an activity that they can utilize while they are being isolated or by themselves will be also very important. Any way to kind of keep the mind active and positive.
Good tips, Doctor. Thank you. Myla, any questions for Dr. Fontanares?
Firstly, Dr. Fontanares, I'm just thank you for joining us, and this is really informative. My question is more for kids. Cabin fever. It's very common now, especially with this pandemic. Is this related to depression or any type of depression?
I'm sorry, what was the first word? The
cabin fever.
Cabin fever. Oh, yes. Yes, absolutely. With kids, especially at this time, the routine is totally off, right? They usually go to school, they hang out with their friends, they have a whole routine that's outside of the house. And now that, the pandemic is here and schools have, closed or they've opened or, there's virtual learning, and that there isn't quite like the similar routine that they thrive on. And kids, they thrive on social interactions and not needing to interact with their parents all day, right? So of course, when they're doing school at home, and also there's what we call like Zoom fatigue, or virtual meeting fatigue, where I believe there's a whole it takes a lot of mental energy to do like a virtual chat, kind of video chat, and that's what we're seeing with a lot of people, especially kids, and so of course they're going to feel a lot more irritable or anxious, staying at home and not being able to go out and socialize as usual and kind of expend that energy. So yeah, it's
Sorry. Thank you for addressing cabin fever. Last but not least, real quick question for Dr. Fontanares before we let her go. Mayanne?
Well, Ace, yes, I have a couple, but I guess I'll just limit it to one. We mentioned earlier that it's more women are more prone to SAD. Is there a study, doctor, why women are more prone to this? And well, okay, I'll ask the second one. Is it a recurring thing, or is it something that we can cure permanently? Thank you, doctor.
Okay, real doctor, sorry, but
oh, it's totally fine. Thank you for again having me. So I am not totally aware of what the exact research is around why women are more, I guess, prone to SAD. We see these numbers too with major depressive disorder. Of women are more likely to develop depression versus many other mental illnesses. So I'll get back to you on that, but I don't have quite the answer exactly what the biology is behind that. But in terms of the second question of like whether or not we're able to cure it, like with many other all mental illnesses, there isn't like a surefire like cure-all. It's not like putting a band-aid or like a cast on like a broken bone. It does take maintenance. It does, what we see in treatment is being able to manage symptoms better is as kind of the improvement that we see with patients. So being able to identify it first and creating a treatment plan.
We will have a separate session with Dr. Fontanares. Pretty sure this will be another 2 hours with you, doctor. And thank you again. Thank you so much for joining us tonight and for discussing for us and with us the seasonal affective disorder. Although we discuss SAD, we do not end with a sad note. We continue to express our appreciation for our healthcare workers, first responders, and essential workers. You are our modern day heroes. Again, thank you so much, Dr. Fontanares. See you again next time. That is today's Seasonal News America. Thank you for joining us. I'm Ace Ramirez. We live in interesting times.